Yes, I have taken a part as a consumer co-facilitator, which involving running a part of activities with CanEngage team member in the group workshop. I always encouraging consumer participants to share their idea and to feel comfortable. Also, through this role, I actively participated in decision making for workshop activities and provided feedback when making resources with the other team members. Really, I got positive experience from working with this team, and CanEngage provided a training at the beginning of the workshop, which was really useful to understand the structure of this co-design workshop. And I always got good support from CanEngage team to take a part before and during the workshop. Working with them really extend my experience and knowledge to work as a co-facilitator in co-design workshop. Hope in future I can involve with more research project like that.
As a social welfare worker and an accredited trainer, it gave me the opportunity to go back, to use my skills, because after I got sick, I had like a year. I was so busy with treatment and all that stuff. So I stopped work and I had no option except to resign from my job. So it gave me actually to use my skills, my training skills, my advocacy skills, my language skills, my consultation skills, and I used to do lots of facilitation of meetings and training and all that stuff. And it was great to go back to that and meeting lots of people, either from the CALT communities or the wider community, where, we did lots of consultations with them and asked them and talked to them about gaps and what's available and what's not available. So that was a great thing for me, because it helped me even in my to use my own skills.
My major function as a consumer representative in the consumer advisory group and project was to bring consumer perspective to all decision making and to build solutions that work and which do address problems identified. So my experiences were right from the beginning, from project logo design, part of the recruitment process of consumers from the culturally linguistic diverse backgrounds, reviewing the project plan, drafting each co-design workshop, co-authoring frameworks and checklists, feedback loop on the Make It Meaningful tool with the aim to increase knowledge and understanding about the medications and the side effects, the information about whom to contact when issues arise. We looped feedback on the design, layout, words, concepts, images, accessibility. Was it user-friendly? The communication styles, interpretations, and translations. It was a collaborative process that engaged with consumers in an equal partnership that sought meaningful, realistic, and workable solutions and real issues faced. It was a process of designing services and interventions based on fully hearing consumer community voices such as myself and enabling equal and shared ownership of the design of responses.
I started on the CanEngage Advisory Committee, providing input based on my own lived experience, as well as the information that I received from the ladies that attend the Sister Cancer Support Group. And afterwards, I was asked to attend the training for co-design training. And that is where I learned about the experience-based co-design methodologies. And I also participated in the co-facilitator training as well. And it was fantastic to get all these training. And the best part is that I get assistance from the support group that is established for consumer co-facilitator group. So that was very, very helpful. And also, I also worked on the project as an assistant investigator, and that really opened my eyes and learned more about research work that has to be done. And the best thing is that I even get an opportunity to review and co-author some papers that come out of this research work. And especially the work when I work very closely with Professor Harrison and her team in the publication of a guide to providing review and feedback as co-author document. And that was a fantastic experience for me. I was invited to attend the HSR 2022 conference in Sydney and was asked to be one of the presenters to present a consumer perspective on optimizing co-designer of health service intervention, and also been given an opportunity to chair a conference section on culture and linguistically diversity, which I thoroughly enjoyed. So the experiences are so immense. I cannot list enough. Yeah.